Hello friends, this is Dr. Ashok Hande. I am a neurosurgeon attached to Fortis Hiranandani Hospital in Mumbai. I am in practice for last 36 years. And in the last 36 years, we have treated many patients with brain injury, brain tumor, brain stroke. The usual question which is asked to me in such cases, whether brain will regrow after the injury. And my answer is no. Plain simple no. Like if I cut a piece of a skin, the skin will grow, the nail will grow after they cut, hair will grow after they are cut. But brain cell once die, it does not regenerate. Period. There is nothing else. But I don't want to disappoint you on this particular thing, because for you to understand once the brain cell die, why it does not regrow, or sometimes people ask, the injury inside the brain is like very small injury, like a half a size of a peanut, but why do I have such an extensive problem in the brain? For that, you need to understand certain anatomical aspects of the brain. The basic unit of the brain is called the neuron, and neuron is a star-shaped structure with a central nucleus. And this neuron has got multiple tentacles like an octopus. They are called the processes, and these processes are interconnected, and that's how in the brain there is an extensive network of axons and the neurons. If I connect these connections or axons end to end, in an adult brain, this will run for something like 320,000 kilometers. Can you imagine how extensive the network is inside the brain? And when a small area of the brain gets involved in any kind of insult, be it the injury, be it a brain tumor, or be it a brain stroke, along with the cell, that cell also lost its connection to the million cells around. That is why if the injury is very small, it can produce an extensive neurological deficit. Unfortunately, the neurons, once they die, they do not regrow. But what is very classical of brain can rewire itself. It can develop new connection to the area around that. And this is called the neuroplasticity, which is extremely unique to the brain. That is why you will see people where the brain is damaged because of injury, brain tumor or brain stroke, they recover after a certain period of time. So one of the reasons for them for the recovery is the neuroplasticity. In our brain, there are certain cells which are hidden. Like the area is called the hippocampus, the area which is called the olfactory bulb, the area which is called the periventricular areas of the brain. They house the stem cells. Sometimes the stem cell can get migrate. They can migrate to the area of injury. They can help the patient to recover to some extent. But generally speaking, brain cells once die, it does not recover. It can get rewired, and that's the main reason for recovery of a patient after the injury. But this recovery is always partial. It cannot recover completely. Now, there are certain things that you have to remember which you can do to help or fasten up the recovery process, and it involves certain kind of brain exercises. Brain improves when it is taught to do some new activity which brain has not learned before. For example, if you're right-handed before the insult, if you start writing the left hand, probably brain will develop new connections. There are certain mental exercises, which is also called the neurorehabilitation technique. All these things together with a very good diet, very good exercises, mainly the mental exercises, you can help the brain to recover faster. And if you're a diabetic, you're hypertensive, you've got to keep this disease under control, which will also in turn help to brain to recover. So guys, please remember, take care of your brain, because brain cells once die, they don't recover, they can just get rewired, and this rewiring can be only partial. Thank you so much.